Thank you, Deputy Speaker. And today I grieve for the state of the public health system in Sunraysia. The continued ignorance, and we are being ignored at every turn by the Andrews Labor government towards the health needs of the Sunraysia community, and it's nothing short of disgraceful. The people of the Northwest have waited patiently for the release of the master plan for the Mildura-based public hospital, which they remind us at every turn was handed back to the public, and yet the Health Minister comes to Sunraysia last week to declare that no public that we've handed the hospital back to, we're actually not going to release the master plan to you. Outrageous. You won't be privy to the plan that we have for your public health care and for your hospital. Now, in my mind, there are possibly three key reasons for this, and for keeping it hidden from the public. But first, I'm going to give this all a bit of context. Now, the previous Health Minister, Martin Foley, stated in a media release in May last year that stated, and I quote, "To support the future health needs of the local community, the government is progressing a master plan which is on track to be completed in mid-2022. The master plan is assessing the feasibility of expanding the existing hospital while comparing this with developing a second hospital campus elsewhere." End quote. Excuse after excuse for the delay was offered up after this media release in May 2022, first by the former Health Minister, Mr Foley, and now by the current Health Minister. Then, during the election campaign, the people of Mildura, and we do cater for that hospital, takes in a tri-state area because that is where we are as far as isolation goes. We serve people from as far up as Broken Hill and over into South Australia. It's a tri-state catchment we're operating on. During the election campaign, all of those people watched as Labor announced funding for other regional hospitals all over the state, but nothing for us. However, the Nationals and the Liberals committed $750 million for a new hospital. $750 million. Now, let me be very clear here. The thing that Mildura-based public hospital does have is incredible staff. It's absolutely not an attack on them, although some people might like to tell you otherwise. The system is broken, and this is a grievance of the people. The staff care for their community whilst working in a facility that no longer meets the needs, the healthcare needs of the region. Patient wait times in the ED have exceeded 12, 15, 18 hours, and this is unacceptable. Unacceptable not just because they're waiting there for up to a day to be seen. We have no choice. Because of our isolation, we can't just pop to another ED. One does not exist. And we talk about priority primary healthcare clinics. The one that they've opened and bang on about in Mildura is open 1 day a week for a few hours, serviced by a GP that services everything else. And without him, we would truly be lost. The Andrews Labor government clearly has no plans and has committed to nothing. In fact, quite the contrary. The current hospital, as I said, it no longer meets the health needs of the Sunraysia community. And a new world-class hospital, teaching hospital, as well as a state-of-the-art GP clinic that we can also teach in through the Monash School of Rural Health, so that our incredible rural generalist, Dr Travis Taggart, can train new GPs like he has been talking about and wishing for on the ground in Mildura. What a way to grow your own workforce and keep GPs in the regions. It's quite literally now a matter of life and death, and I am getting calls every single day to my office of people that want to raise this issue, but they don't want to complain. They don't want to raise a formal complaint because they don't want it to reflect badly on the staff, because the staff are doing an incredible job in a system and a facility that is broken. Now, I was admittedly concerned when it was announced that it would be handed back to public management. I thought, yeah, okay, this will make a good media release, maybe it will be a good thing. But I was concerned that as soon as this happened and the media was done, that it would result in the hospital being underfunded and ignored by Labor. That's exactly what's happened. These concerns have become a reality with the refusal of the Andrews Labor government to progress and release the master plan and even acknowledge the obvious need for a new hospital. Even worse, the 2022 financial statement for the Mildura-based public hospital for the year ended 30th of June 2022 shows that the Andrews Labor government has failed to provide sufficient operating funding to cover the operating costs of the hospital. What a surprise that funds have been mismanaged. There's a pattern here. In the 2021-22 financial year, the hospital recorded an operating loss of $2.337 million. The net financial result for the period saw the hospital record a net loss of $3.743 million. This is not the financial result a public hospital or health service would incur if the government provided sufficient and adequate recurrent funding. And the concerns that I held at the time of the change of management have become a reality. Labor talk a big game about their commitment to the Victorian health system, but the system is broken due to a systemic lack of investment by this government, and the Mildura-based public hospital is a prime example of this. Now, on the 3rd of May this year, I invited the Minister for Health to Mildura to release the master plan. Last week, she came to Mildura, but not to release the master plan. No, we didn't catch up. I wasn't invited. Quite the contrary. We'll get to that. To make an announcement, not for a new hospital, but for $14 million for medical records upgrades in Mildura, Swan Hill and Kerrang. Medical records are important, no doubt, but this is a distraction tactic. We'll sprinkle some funding over it to make it look like we care, but it's a token gesture, along with a couple of other health services. Medical records are important, but it is infuriating when we have been screaming out for a master plan, 30 new ED beds and a new hospital. We need it. Honestly, I mean, what are we to be taken for? Just because we live where the sun shines doesn't mean that we are silly. We can see exactly what's going on here and it needs to be called out. Further to that, and here's the kicker, she stated to the press in a press conference that the master plan would not be released to the public. The minister stated that the master plan would not be released to the public, that it is an internal working document and would not be released. Outrageous. Especially, here's another kicker, especially after she said multiple times in this place, along with the Premier, that the master plan would be released soon. We've been led down the garden path, it seems. Let's refresh some memories. On the 31st of August 2022, the Minister for Health said, and I quote, "The 2021-22 budget did include $2.1 million to develop a master plan for the Mildura-based public hospital. I want the previous member, to know that work is very well underway and is very close to being finalised. I look forward to having more to say on that in relation to this once the work is finalised." 12 months later, a backflip. No. Who'd have ever thunk it? The Premier said on the 22nd of June 2022, there is a master plan process that is underway and the government, in its decisions for the future, will be well informed by that master plan process. End quote. He also said, in a response to a supplementary question from the previous member, "We will be informed by the master plan and of course we will work with you to lobby the new federal government to make sure that they can be a partner in any improvements for health, particularly in rural and regional Victoria." Well, Premier, you can work with me. I will lobby whoever we need to lobby to get a new hospital and to get the health care that people that are putting food on your plate deserve. Now, I've brought it up and I have asked for the release of this master plan on the 3rd and the 18th of May, and also in the other place it has been brought up on the 5th of April, the 8th of February this year, and also the 22nd of May. And yet, all we're getting is radio silence. They spend all this time looking back at handing back a hospital from third-party management, but you're never going to get anywhere looking in the rear-view mirror. We need to be looking forward now. You might well say that the current Mildura Hospital was built for profits. We've heard this over and over. But when it was run by a third party, they didn't have to beg for critically needed new ED beds. And documents like this were delivered at AGMs when they were required. I'll say it again. The staff in this hospital do a remarkable job. An absolutely remarkable job. There isn't enough of them, but they are doing a remarkable job, sometimes having to work in hallways, seeing patients in waiting rooms, having to send people home when they know they should be in a hospital bed, but they simply physically don't have the room. They all deserve a medal, they really do. And everyone that contacts my office, like I said, they don't actually want to raise a complaint because they don't want it to reflect badly on those amazing staff. They are absolutely brilliant. So don't let them on the other side tell you that we go attacking healthcare workers. That's absolutely not the case. We're attacking the system, the underfunded system and the hospitals and the healthcare system in regional and rural Victoria that are getting ignored, especially one like this that takes in 3 states. It has a catchment of 3 states and over 100,000 people that this hospital serves. What they are doing in this hospital and within this system is truly remarkable. Now, in my mind, there are a few possibilities as to why the master plan will now not be released, despite it being stated that it would be released. Well, one, it doesn't exist. Maybe the master plan just doesn't exist. Well, there's a couple of others yet. Let's not jump to conclusions too quickly. 2, the master plan shows that they plan to cut services. Cutting services to perhaps maternity, which has already been done, or other critical services. It could. We don't know until it's been released. There could be many theories until it is in front of me, in black and white and in front of the public, that it is being returned to. We won't know.
Order.
Okay, the third one, number 3, and this is a real concern for everyone in our region, that the master plan shows an amalgamation with Bendigo Regional Health, bringing it in from a sub-regional health hospital to a regional hospital, which then has the potential also to take in the incredible multi-purpose services that have amazing funding models and serve the communities of Robinvale and the Mallee Track in the best way possible because of that funding model for the MPSs. We want to protect that with everything we can, because if they are absorbed, we risk seeing what has happened with Grampians Health occur in my region. And I will not stand for it. I will go down kicking and screaming to protect those MPSs. So, which is it? Is it number 1, does it actually exist? Well, we don't know. Does it show a cut to services? Well, we don't know. Or is it written on the letterhead that shows Bendigo Regional Health? Show us the plan. That is all. It is a public hospital, and I grieve for the people of this Greater Sunraysia region, the people that it serves in New South Wales and the people that it serves in South Australia. Because if we continue down this road without a plan that is available to the public so that they can at least have their say on this, that their taxes are paying for, then of course we are on a road to nowhere. It is an absolute disgrace that after being invited to Mildura to release the master plan, that the minister would actually do the opposite and come to Mildura to announce that there will be no master plan released to the public. It is absolutely outrageous. And they need to release where the master plan is up to right now, whether it does exist, whether it doesn't exist, accountability. That's all we want, accountability. And it appears as though the Premier and the Health Minister couldn't even spell it.